My name is Abbey Fingeret, and I am an endocrine surgeon focusing on diseases primarily of the thyroid, parathyroid, and adrenal glands. I originally grew up in Pittsburgh, Pennsylvania, and from there went on to undergraduate training at Cornell University, did my general surgery residency at Columbia in New York, and recently finished a fellowship in endocrine surgery at Massachusetts General Hospital in Boston. I didn't know much about the University of Nebraska Medical Center. I didn't know anything about the Fred and Pamela Buffett Cancer Center when I first embarked on this journey. But from the first time that I set foot on campus and met with people like Dr. Thayer and Dr. Cowan, it was very clear that my goals and objectives very closely aligned with the mission of the Fred and Pamela Buffett Cancer Center. Once I started hearing about the resources available and the ultimate goal of treating many subspecialties of cancer, it was like a light bulb went off that this was a place that I was called to. I think that the most exciting part about the imminent opening of the Cancer Center is bringing together like-minded people, physicians and nurses and scientists, all with clear goals to change the way we diagnose and treat cancer, but also to change the way we think about cancer in terms of prevention and hopefully ultimately one day cure. My goal is to provide endocrine surgical care to the level that is provided at places like Memorial Sloan Kettering Cancer Center in New York City or MD Anderson in Houston, Texas, and I think it will only be a matter of time and a brief amount of time at that before the Fred and Pamela Buffett Cancer Center is held akin to those peer institutions.
My name is Mohammed Baljevic, and I will be focusing on the treatment and management of plasma cell dyscrasias as well as benign hematologic conditions. I'm originally from Bosnia. I graduated from Weill Cornell Medical College in Qatar with honors in research, and I completed my medical residency training at Cornell Hospital in New York, from where I moved on to Houston at MD Anderson Cancer Center, where I did my hematology oncology fellowship. One of the main things that attracted me to University of Nebraska Medical Center was the visionary leadership of the people that I met during my interviews, as well as really the kindness of everybody that I met. I think any patient should expect to receive a world-class care as well as have the chance to be exposed to the latest research trends, latest treatments for their ailments, and that is exactly what I hope to contribute here at the new Cancer Center. We are primed to be the top academic and referral center in the Midwest, certainly. I am very impressed with the infrastructure that's rising before our eyes, and with the multitude of new laboratories that are opening up, as well as the presence of investigators that are already very much active. I can only imagine that with the new facilities and the new clinics and just a new space that's going to be so much bigger than what we operate with right now, can only improve on the quality and the expediency of care that we can offer to our patients.
My name is Sarah Holstein, and I treat multiple myeloma. I did all my training at the University of Iowa, so I did the MSTP program there, which is a MD-PhD program. After that, I did an internal medicine residency, followed by a hematology oncology fellowship. There were really multiple things. The first is its long history of doing excellent cancer research. The second is the obvious fact that the city is embracing medical research and is embracing this university. The third is the wonderful environment of the Midwest. I was, born and raised in the Midwest. I really wanted to get back to the Midwest. And the fourth really was all the new collaborators that are here that I'm really excited to start working with. The thing that really impressed me about this cancer center was the vision of having everything in one place. So having everybody who's doing anything related to cancer research and the care of cancer patients in one building, so that can really facilitate discussion amongst both researchers on the basic side and also on the clinical side. I think the more that we can collaborate and bring together specialists who perhaps don't often think that they are working on the same thing, the more we can pool our resources and really increase the reputation of this facility. I think Patients are going to want to come here because they'll understand that cutting edge research is being done in their particular malignancy. So if it's myeloma, for example, they'll know that there are researchers here who are working not only in the lab to come up with new drugs for myeloma, but also that there's new and exciting clinical research happening for new therapies.
My name is Kevin Zhang. Actually, I enjoy patients call me Kevin or Dr. Kevin here. I had my medical degree from University of Miami, School of Medicine at Miami, Florida. Then I continued my radiation oncology residency training at Columbia University Medical Center, New York Presbyterian Hospital in New York City. The Fred and Pamela Buffett Cancer Center is designed in a unique way to bring the future medicine from the bench side to the bedside. This again fits my personal goal of being a physician scientist very well. I'm also excited because I can probably go to my research lab just in 5 minutes. I can also talk to my radiologist colleague just across the hall. With this kind of approach, we are expecting to develop new approaches of treating cancers. I'm really glad I'm catching this opportunity to see this new approach of practicing medicine happening within the next few months.